I'd forgotten how to remove the video intro. Hi guys, welcome back to another live stream. I'm Dr. Sylvia. I hope you're having a good Sunday. Thank you so much for joining me. I really appreciate your time. Very quick one today. We're not going to spend more than 15 or 20 minutes, but I really wanted us to have a conversation about how to talk to your general practitioner, your family doctor, about ovarian cancer symptoms. As you know, March is Ovarian Cancer Awareness Month here in the United Kingdom. So we decided to dedicate our videos and our live streams answering questions or having conversations around ovarian cancer symptoms. So you're very much welcome. As usual, engage in the comment section. Let me know if you have any questions on this subject. You know I like to hear from you, and I'll do my best to answer as many of them as possible. So we're going to be, in a minute, I'm going to be sharing some tools I think will be very useful for having this conversation when you want to talk to your doctor. But I'm also going to talk a little bit about the symptoms of ovarian cancer and, you know, how to get your head around some of the description that you might see in the public space, or you might see in different campaigns that you hear around ovarian cancer. Before I do that, though, I'm just going to ask you to please give this video a like. Don't forget to like, please, and if you're interested, by all means, please consider subscribing to the channel. Very, very much welcome to do so. And don't forget that I will place this in the description box by the time I end this stream. But don't forget that you can also continue the conversation with us. Because there's so many other things that are happening. If you look in the description box, you'll find a link to the mailing list where you can join our community and receive a weekly newsletter that we're publishing full of helpful tips, helpful health information. There is, of course, our symptom tracker or free symptom checker that you can use to guide any health concerns. You can pop in your symptoms. You want to get an idea of what it might all be contributing to, whether you should be speaking to your doctor sooner, or whether you should be worried. Please use that symptom checker. The link will be in the description box. And of course, you can use our email health information service to get a response from me or one of our other expert clinicians around a specific issue that might be on your mind. And of course, a very new service for UK-based residents, and which is launching in a couple of days. You can book an online private GP consultation with me or one of our other clinicians via your GP consultation. So I'm really very excited about that. It's starting very, very soon. Well, it's already started, to be fair, but we're launching it very, very soon, and hoping to engage and provide health service across the board. Right, so let's get into the conversation for today, which is around ovarian cancer. Like I said, it's March is Ovarian Cancer Awareness Month. The ovarian cancer means cancer of the ovaries. The ovaries are part of the female reproductive organs, and the ovaries are very important. They are the storage center for the eggs that a woman ovulates every single month while she's in her reproductive years. And of course, it is the fertilization of the egg that gives rise to the birth of a baby. So the ovaries are important for being the storage centers for the eggs, and they also produce reproductive hormones, estrogen and progesterone. So these are very important organs. And ovarian cancer is cancer that develops in any of the tissues of the ovaries. What are the symptoms? Now, I really want to share, because I think they've done an amazing job, I really want to share the toolkit from Target Ovarian Cancer. I don't know if you guys can see that. Oh, I don't know how well it's showing. Let me back up a little bit. Well, I don't know. Yes, I think this looks better. I'm going to share the screen anyway. But Target Ovarian Cancer is an organization here that's doing a lot of work in terms of raising awareness around it. And some of the symptoms of ovarian cancer, we're going to talk about that in a moment. The challenge with ovarian cancer, and I want to say that off the bat, is that sometimes the symptoms are not very specific to ovarian cancer. They can be symptoms that could happen in so many different conditions. And that's why it's a challenge sometimes for diagnosing this condition, and sometimes why it's diagnosed at a late stage. So it is actually described as one of the hardest cancers to treat, because many times those symptoms or signs of ovarian cancer, we don't pick them up until the very later end stage of the disease. And sometimes it's also misdiagnosed. There are lots and lots of stories that I know that you come across on the internet, or even amongst people that you know, where they talked about how it took several months before they eventually had the test that led to the detection of ovarian cancer. And that's why, for me, it is so important to have this conversation. So there are different symptoms. There are some that, you know, we don't want to miss. But really, if there's any symptom that worries you about your health, please speak to your doctor. We're all about advocacy. We're all about, you know, empowering men and women to have a conversation with their healthcare providers, not to be fobbed off or intimidated, simply to be persistent. Keep going back. If you feel you're not being heard, or if you feel you're not getting the right answer, get a second opinion, speak to another doctor. And these are the different things that you could do. So let me share my screen. Let me bring up the ovarian cancer, the target ovarian cancer symptom diary, so that you can have a look at it. And I'm going to place a link to this in the description box as well, so anybody who's interested in getting a copy of that. Hang on, let me just let me make this bigger, and then so that you can, oh, too big, right? That's it then. Okay, so hopefully you should be able to see on the screen. This is the symptom diary, similar to what I've got here, but that's the PDF version. Okay, so it talks about the different symptoms. The first one is persistent bloating. Now, we all know what bloating is. We all have experienced bloating at one time or the other. You've had too much to eat, or you've eaten something maybe a bit spicy, and you get really full of air, full of gas. That's the bloating sensation in the abdomen. And really, if it's that you've eaten something that's, you know, maybe a bit too spicy, or something that's not sort of agreed with you, then that bloating will eventually settle down. It's not a type of it's not a symptom that's going to continue, because eventually, thanks to bowel movements, the gas should pass out of your system and the bloating settles. But this is not the case with ovarian cancer. So we're talking about a type of bloating that doesn't come and go, and a type of bloating that doesn't get better. This is a persistent symptom. So it's a symptom that continues. You try everything possible. You take peppermint tea or chamomile tea, you know, you eat mints to try and get rid of the bloat, as we do. These are over-the-counter treatments, but it doesn't get better. So one symptom to be aware of, that if it's something that is carrying on for some time, is not getting better, is bloating in the abdomen, speak to your doctor. If it's something that is not coming and going, it's not getting better. The second one is feeling full quickly and or losing your appetite. So feeling full quickly after you sit down to have a meal, within a couple of minutes or within a couple of bites, you feel full. You know that you have not eaten enough to explain the kind of fullness that you're having, or you have lost appetite and you're not trying to lose weight, or you're not trying to do anything, you're not taking weight loss treatments or anything like that. So that symptom, that second symptom, feeling full quickly, that's what it means. It means that when you sit down and you get full before you have consumed the usual amount of food that will usually satisfy you. So you might usually be satisfied with a plate of a meal, a standard plate of food, but you find that by the time you've eaten less than a quarter or less than half of the plate, you're full. Okay, if that is happening persistently, so it's happening for several times, and I'm going to talk about the frequency or the number of times in a month that it's recommended that you should become concerned and then speak to your doctor. But if you're experiencing that symptom, please keep an eye on it. And that's why this symptom diary, I think, is so important, because what it does is it gives you space to be able to track the number of times that you're experiencing them week after week. So in a period of 1 month, if you have those symptoms, by the time you're listing maybe 3 or 4 times a day, and this is happening 4 or 5 times a week and happening every single week of the month, then you know that is a significant symptom. All right, the next one is pelvic or abdominal pain. Now, people can experience pelvic or abdominal pain to different degrees. This is fine. I don't want anybody to get confused. I think that if you're experiencing pain that is either severe so preventing you from doing anything, even if it's just the once, or if you're having a pain that is maybe not so severe, but it's enough to sort of stop you, enough to keep you uncomfortable. You take some simple painkillers, it doesn't get better, please speak to your doctor, okay? And then the other symptom that it lists on this is urinary symptoms. So what are these? Now, urinary symptoms, usually in this context, they're talking about frequently going to the toilet to pass urine, but it could be other urinary symptoms. So if you find that you're going frequently to pass urine every hour, every couple of hours, when usually you might be able to stay for 5 hours before you have to empty your bladder, then this is something to bring to the attention of the doctor. If it's happening several times over the course of a month, or if it's happening several times over the course of a couple of weeks, this is something that you need to bring to the attention of your doctor. Other symptoms, of course, that could be urinary symptoms include frequent urinary infections. You might notice that your urine appears different, might smell different. You might notice some blood in the urine. Those are symptoms that happen that should bring you to the attention, or you should bring to the attention of your doctor. It also talks about some other symptoms. And again, because like I said earlier, you might get certain symptoms that could also happen in other conditions, and they don't necessarily mean that you have ovarian cancer. What we're saying is that experiencing these symptoms over a period of time more often than what anybody should is what should bring you to the attention of the doctor, and therefore they would arrange for you to have some tests. So some other symptoms that we should be aware of, and these are common, especially in different types of cancer, for example, bowel cancer, or it could happen in leukemia, different types of cancer. You would have something like fatigue, so being very tired, you feel exhausted, even though you haven't done the amount of work that could or would explain that degree of tiredness. Or you might experience changes in your bowel habits. So for example, experiencing loose stools. You don't have a stomach you don't have food poisoning, or you don't have a stomach infection, but you notice that your stool pattern, or your stool consistency, I should say, has changed, either to loose stools, or you're struggling to open your bowels, you're constipated. If you're experiencing those kind of changes, then it's important to bring them up with your doctor. Another symptom that does not necessarily immediately point towards ovarian cancer is having unscheduled vaginal bleeding. Now, this can be whether or not you have reached menopause or after the menopause. Any bleeding that's unexpected, unscheduled, is not the usual pattern, is not expected. You need to speak to your doctor about it. These are just some symptoms that could happen in the context of ovarian cancer. The most important thing is that they're happening, and you're able to note them, that they're happening frequently, they're happening persistently, and so that means you need to bring them to the attention of your doctor. So we will usually recommend that if you have these symptoms going on for 2 weeks, speak to somebody. Don't think, oh, it's something that's just going to get better. Don't assume that. I think the first port of call is to address your concerns with the healthcare provider, and then that's the opportunity to have the conversation about whether they are occurring frequently, or whether this is something that's coming and going. Because if you're not sure, it's fine. Go ahead and speak to your doctor. The other thing to say is that if they're happening for more than 12 times in a month, so I've mentioned the symptoms. I've mentioned feeling full after eating. I've mentioned persistent bloating, so that's bloating that's not coming and going. We've talked about experiencing pelvic or abdominal pain, urinary symptoms, weight loss or fatigue, and so on. If you're experiencing these symptoms and they happen more than 12 times a month, so that's why you'll see it on the bottom half of your screen. That's why I'm sharing it, because I know you won't see it in my little card that I'm holding up here. But on the bottom half of the screen, what you will see, let me just take myself off here. Okay, so what you'll see is the week 1, week 2, week 3, week 4, and it gives you the opportunity to make a note of whether you experience this symptom on a daily basis. And so by the time we can count that you're experiencing this symptom for 2 weeks or longer, or more than 12 times in a month, please bring that to the attention of your doctor. Okay, so I'm going to leave the link to this symptom diary linked in the description box so that you can see it. Where am I? Okay, so I'm going to leave it linked for you in the description box so that you can have a look at it. And if you want to download it, or if you just want to, save this video, keep it in the back of your head, because I don't want us to think that ovarian cancer is something that only happens to people in their 50s or in their 40s or in their 60s. No, it can happen to anybody. Yes, of course, it's more common as you grow older. Yes, I completely, that is, that's true. However, in some cases, for some, one reason or the other, it could happen in younger people, and particularly in people who may have a genetic tendency or a genetic risk because they carry certain types of genes. You might have heard about the BRCA gene, where people who carry that gene, or families where that gene is being transmitted, may have an increased risk of things like breast cancer, ovarian cancer, and so on. So that's something that's really important. So we're talking in this video about how to have this conversation with your GP. And I've just covered the symptoms because that's the first place to start. You need to know when should you come to speak to your GP. So now let's look at how to have this conversation with your GP. Please don't forget to give this video a like. And if you're joining, hi, where are you watching from? If you've got a question or even an experience around ovarian cancer, please let me know. Always good to hear from you. So how to have this conversation with your GP. I think it's really important that having the conversation with your GP does a number of things. Okay, it explores your symptoms. So if you're not sure, and at the point where you have your symptom, we don't want to assume that it's an ovarian cancer. We can't do that. The intention is to explore the symptom. So it's important that you're approaching the GP with enough information. Don't think that anything you say is irrelevant. Let your doctor be the ones to help you make that decision, because you might be thinking that there's this particular symptom that doesn't mean anything, but it may help to put things together and help push your doctor to say, right, we need to get this test done. So if you can, please provide as much information as possible. But let me back up a little bit. You might go to we have different types of different ways that our surgeries can sometimes provide appointments. And I think that if you're the kind of person who needs to have a sit down with your doctor and have a lengthy conversation around your symptoms, you might want to talk about your family history and so on, then you can look or ask about booking a longer appointment when you ring the reception, if that is available to you. Or it might be that it's not available, then fine, take what is offered, take the first appointment that you can get, whether it's with a doctor you're familiar with or not, but at least let's get it started. It may be that you're able to cover at least some bit of information in the first 10-minute appointment, and then you can agree with the doctor that you see that you need a second follow-up appointment or a phone call or something, to have that conversation. So make sure that you've gathered all your information together. If you can, download the symptom diary and make a note of the symptoms that you're having, how often they're happening, and so on, and anything else that you think might be useful. The fact that you have a family history of cancer, if that exists, is also important to bring to the attention of your doctor. Okay, so in terms of having the conversation with your doctor, you've got your symptom diary with you. Your symptom diary contains the different days or dates when you're actually having those symptoms. Fine. I think it's also important that you say, I am concerned about so and so. So hopefully you listening to this video, watching this video, have some awareness about ovarian cancer now that we're having this conversation. Or you might have picked up different things from different, different sources. It might be the internet, it might be somebody that or an experience that you shared with somebody and so on, but you have information, and this is what is prompting you to write this diary. And please say to your doctor, I'm worried about ovarian cancer, so that we can move forward in that direction, or at least have it in mind that this is one of the things that we need to consider as we explore the symptoms. Of course, after having the conversation with you about your symptoms and checking the other aspects of your history, your doctor might want to do an examination and have a feel of your abdomen and pelvis. They might just want to have a general examination as well. Now, where we're trying to get to is a test for ovarian cancer. That's what this consultation, this conversation, this keeping this symptom diary, that's where it's leading to. It needs to end with an arrangement for the tests to see whether or not ovarian cancer is present. It's not just to go and have a conversation. The symptoms don't tell us. They're not specific enough to say, right, this is definitely ovarian cancer. So we need to have tests done. The first test your GP will usually arrange is a blood test. It's known as the CA125. Now, arranging that blood test is one of the markers that could indicate that ovarian cancer is present. The fact that it's positive does not mean that an individual has ovarian cancer, because that that blood test, that marker can be raised in other different conditions. But it's one step forward in trying to work out what is going on in the body. The very next step is an ultrasound scan. The ultrasound scan is the barest minimum that somebody, a doctor should arrange for a patient or somebody who comes to them, says, oh, I've been getting persistent bloating symptoms. I feel bloated. I feel full quite easily, just a few mouthfuls of food, and I feel quite full. Or they've experienced weight loss that's not planned. So somebody who's dropped a couple of dress sizes in 2 or 3 months. So quite drastic, quite significant weight loss in a short period of time. And doing a scan combined with the CA125 are usually the two key tests that your doctor can arrange to observe and to detect whether these symptoms are all happening because of ovarian cancer. And one thing I didn't say when I was talking about the symptoms, you don't need to have all 4. This is not showing very well. You don't need to have all of those symptoms listed in this booklet, or all the symptoms before you go and see your doctor. You can just have one. It may just be that you're having frequency passing urine. Why in the last 2-3 weeks have you been passing urine more frequently than usual? What's going on? Please speak to your doctor about it. It may just be one symptom that you've been able to pick up on. So you don't have to have all the symptoms. They don't all have to be present before you go and have that conversation with your doctor. Okay, so today's video, we wanted to talk about ovarian cancer symptoms and how to have a conversation with your doctor. I feel it's really important that as women, we advocate for ourselves. Sometimes you might find that your concerns are not taken forward the way that you feel they should. And please don't get fobbed off. If you need to get a second opinion, go ahead and do so. If you need to see another doctor and say that these symptoms are not getting better, then you can go ahead and do so. Sometimes I come across people who initially go and see their doctor and they're told, try this or try that, and then they don't go back to follow up when things aren't getting better. So what I'm trying to say is, if it's not getting better, please go back and say, well, I came 5-6 weeks ago about this problem and they said it might be this and I should watch this, but it's not getting better. It's really important that you're going back. I mean, an example is irritable bowel syndrome, which is a benign condition. It's certainly not life-threatening. It can cause disruption to your lifestyle, can cause stress, it can just make one feel uncomfortable, but it's not life-threatening. But it can cause bloating. It can cause bloating that makes people very uncomfortable, bloating that can be persistent, and sometimes it can be mistaken or misdiagnosed for ovarian cancer. And so the point I'm trying to make is that especially for somebody in their 50s and above, they wouldn't all of a sudden start developing irritable bowel syndrome at that age. If somebody were to have irritable bowel syndrome, probably they would have developed this condition several years ago. So for that to start all of a sudden at mid-age or from the age of 50, that I think is a red flag, is a red herring that your doctor will be aware of. And the point is, if somebody says to you, oh, this is probably irritable bowel, it sounds like IBS, and they ask you to go away for a couple of weeks, please go back if the symptoms are not getting better. Don't forget to trust your instinct. I think that's also very important to say. Guys, that's it. I'm going to wrap up today's video. I told you it was going to be a very short one, but I really wanted to cover 2 key things: symptoms of ovarian cancer, and we've talked about them. So just to recap: persistent bloating, so bloating that's not coming and going, feeling full or loss of appetite, experiencing urinary symptoms, experiencing pelvic or abdominal pain. I also mentioned symptoms like losing weight, feeling very tired, and unscheduled vaginal bleeding. But if you're concerned about anything else, if you're concerned that your body, because you know your body, if you're concerned something is not working right, please speak to your doctor. And then I've also gone through how you should have this conversation with your doctor. Have yourself armed with the information, get the diary that can help you just to keep track of the symptoms, and then you know how long it's been going on for, how long it's been happening, and that helps your doctor to be able to put together a picture of what's actually happening. Tell them about any other symptoms that you're having, tell them about your family history if it's relevant, and then say that you're concerned that this might be ovarian cancer, so that we can address that concern of yours. And if you're not sure, that's fine, but just say, could it be ovarian cancer, so that we are aware that this is a concern that you have, and we can look at that while we're trying to work out what could be responsible for the symptoms. It is important that you have the tests. The tests are a blood test, the CA125, and an ultrasound of your pelvis and your abdomen, because that will visualize the ovaries, and that is what will tell us whether this is cancer or whether this is something else that's going on that we need to investigate further. Right, guys, thank you so much for watching. I hope you found this video helpful, short and sweet, but let me know in the comment section below. Don't forget to check out the video we published on Thursday last week, again sharing some tips about ovarian cancer. Look out for some more tips. I'm going to be sharing some more on Thursday around the same subject, addressing your questions, addressing your comments as well. But anyway, I hope you have the rest of your Sunday goes very well, and I'll see you again soon. Thank you so much for watching. Bye-bye. Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific needs. These resources will help you reach your goals faster and more effectively. Don't miss out on your free copies. Check out the links in the description box below. Before you watch this video, please like and subscribe to the channel so we can continue this health journey together. So, let's get started. I'll see you in the rest of the video. Hi, I'm